Good day everyone, I am Olavario from 2BSNB. So today I will be performing hot water bag procedure and Perilight procedure therapy. So first is we'll gather up all the equipments needed. So we have the draw sheet, the towel, the hot water bag, the gloves, the alcohol, the betadine solution, cotton balls, and a ring light for substitute of infrared light. So first, I will be proceeding with hot water bag procedure. So I'm going to perform hand hygiene to prevent cross-contamination during the procedure. So next is to identify our client. So we will state their name, their age and birthday. So this is to reduce their anxiety and as well to provide privacy. So ma'am, may I know your name? So my name is Alice. I am 30 years old. My birthday is on December 21, 1992. Okay, so we will now proceed on the providing the privacy. So if this is a hospital setting, we will be closing the curtain around the bed and close the door if possible and explain the procedure to the client. So ma'am, I will going to do a hot water bag procedure to you. So this is a stimulation on the skin and on underlying tissues of the heat. So this is to will decrease pain and inflammation and as well promotes healing. Okay, so next we will now proceed on the placing the hot water bag on a flat surface. So in this procedure, I will be using a automatic hot water bag. So if you are going to use an ordinary bag, so you have to place it on the surface, and then assuming that this is the opening of the bag, so we'll be filling up the bag with hot water by half or 2/3. So we cannot fully fill up the bag because it will not be distributed properly if it placed on the client's skin. So next is to place it flatly underneath and expel the remaining air. So expelling the remaining air will release the vapor created by the hot water on the bag. And then, so assuming that this is the opening, so turn the stopper until this is tight. So this is to make sure that if this bag is used by the patient, it will not leak. And then we will dry the bag and then put it upside down. So this is to make sure that there is no leakage. And then put a towel around it. So this cloth may prevent burns on the patient's skin if the patient cannot tolerate the heat coming from the bag. So next is to place it on the patient's skin. So assuming that I will be putting this on the abdominal area of the patient, so we'll be putting this like this. Usually the bag is placed horizontally so that it will not be concentrated in one area. Okay, so that's it for the hot water bag. So we'll now proceed on the Perilight procedure. So assuming we gather up all the equipments, perform hand hygiene, and stating the client's name, age, and birthday. So I will be explaining the procedure. So Mama Alice, I will be performing now Perilight procedure therapy to you. So this will decrease also the tension and relaxes your muscles. So don't worry, because I will be monitoring you and will be on standby until the procedure is done. Okay, so now we'll now proceed on the procedure by putting a draw sheet under the patient's hips. So this is to prevent the discharge from the patient to be spilled on the bed. And then maintain dorsal recumbent position. So I cannot demonstrate it, but the patient should be nakabukaka to proper visualization and exposing the perineal area. So next is to wear gloves. So this is to protect ourselves from being contaminated by the patient's discharge. Okay, so now I will be applying betadine solution on the perineum site or the episiotomy site of the patient. So using the betadine solution. So assuming that I am putting betadine on the cotton balls, so the betadine solution will prevent skin infection and also promotes healing to the client's wound. So now we're going to expose the perineum of the patient. So, in exposing the perineum of the patient, we'll have to make sure and strict with the time. So, if the infrared is at 220 voltage, you have to expose the perineum within 15 minutes and 30 minutes if the voltage is 110. So, because infrared, if being exposed too much to the perineum, will cause burns and it will damage the patient. So, next is to place the infrared light to the client 18 to 24 inches because putting the infrared light too close on the patient, it will be concentrated too much, and if it's too far away to the client, we may not attain our goal in this procedure. So, assuming that the 15 minutes or 30 minutes have passed, so we will now remove the infrared and check for the perineum of the patient if there are blisters, burns, and we'll check for the condition of the skin, so to see if how the reaction of the skin of the patient to the procedure. So next is to change the linen of the patient if there are discharge. So this is if needed. Okay, so after that is to tidy up all the materials needed, remove the gloves, and wash hands. And record the procedure, including the date, time, and the observations made. So this is to see if the Perilight procedure therapy is effective to our patient. Okay, so that's all for our return demonstration for today. Thank you for listening.